Come in.
Hey, Mr. James, how are you doing today?
Good.
My name's Tammy. I'm going to be the nurse completing your assessment today. Do you have any questions? Okay. Well, I'm going to wash my hands, but before I do that, I just want to let you know that today's assessment will be confidential, okay? No questions? All right, let me wash my hands and we'll get started. All right. So, for today's assessment, I'm just going to check out certain parts of your body, and to get started, we're going to do a mental status exam, okay? That mental status exam is not invasive. I'm just going to ask you a few questions, okay? Can you tell me your full name?
Brian Gaines.
Okay. And can you tell me today's date?
March 7th, 2020.
Okay. And can you tell me where you are?
A Cabot Clinic.
Okay. And I asked you earlier, but can you tell me again how you're doing?
Good.
Okay. So the patient is alert and oriented ×4. He has appropriate affect. His mood is good, and his expressions are appropriate as well. Okay. And so earlier I took some vital signs, and his vital signs are as follows. The blood pressure was 118/78 in the right arm sitting. His pulse was 78. His respirations were 18. His temperature is 98.6, taken orally. And Mr. Brian, are you in any pain? Is it okay if I call you Mr. Brian? Okay. So no pain today? All right, and he's not in any pain. Okay, so to get started, we're past that, I'm going to ask you to test your recent and remote memory. I'm going to give you 4 words, okay? And throughout this exam, I'm going to ask you them again. Is that okay? The 4 words that I want you to remember are house, dog, and orange star. Okay? Sound good?
Mm-hmm.
All right. And so next, what I'm going to do is I'm going to take a look at your head. Okay? Is it okay if I touch your head real quick? All right. So the shape of his head is normal cephalic. He's got blonde hair. It's straight and fine. There's no parasites, no lesions, and it is somewhat dry, and the skin is pink, and it is moist as well. He has the eyes in the upper third of his face. His nose is midline, and his mouth is in the lower third of his face. Okay, so just gonna palpate, okay? Is any of that tender?
Mm-mm.
No tenderness, no lumps, no bumps, no discolorations throughout. Okay, so one of the tests that I'm going to do is to test some cranial nerves. And the first thing I'm going to do is I'm going to use a cotton ball, and I'm going to touch portions of your face, okay? And I want you to close your eyes, and then as I touch your face, I want you to tell me what place I'm touching, okay? All right, you ready?
Mm-hmm.
Tell me where you feel that.
Forehead,
Okay,
right cheek,
all right,
left cheek,
okay.
chin.
Okay, great. You can open your eyes. Okay, so his cranial nerve number 5, which is trigeminal, is intact. Okay, and then can you close your eyes for me? I'm going to push up on your eyebrows. Don't let me open your eyes, okay? Okay, can you tighten your jaw for me? I'm just going to push on your jaw. Okay, so his masseter contraction of his muscles is strong and equal bilaterally, and his number 7 facial cranial nerve is intact as well. Are you still doing okay?
Mm-hmm.
All right. So next what I'm going to do is I'm going to take a look at your nails. Okay. And both of his hands are bilaterally on his hands. His nails are pink and translucent. His nails are convex, and they're well trimmed. His capillary refill is less than 3 seconds. And the skin is pink like the rest of his body. No lesions. Okay. And there you go. And I'm going to also take a look at your toes. And the capillary refill on your toes is less than 3 seconds. Okay. And next we're going to go to your eyes. Okay. Okay. On your excuse me. For your eyes, I'm going to do a couple of things, okay? The first thing I'm going to do is just look at them. And his eyes are blue. His pupils are black and round. They're about 3 millimeters in shape. His eyebrows, I'm going to feel your eyebrows. His eyebrows are blonde and coarse. There's no lesions or scaliness. They're symmetrical on both sides. His eyelashes are blonde and they're coarse, and they're evenly distributed through his eyes. They're everted on both the upper and lower lids. Okay, so what I'm going to do now is I'm going to shine a light in your eye, okay? I would normally dim the lights, but I can't do that today. So what I'm going to do is I'm going to cover your eye, okay? And I'm just going to use this light and look in your eyes, all right? Just look at me. Okay. And so follow my pen light for me with just your eyes. Okay. And look at that. One more time. Okay, and then can you look over my shoulder? Okay. So his eyes are, his pupils are equal, round, and reactive to light. His eyes are both consensual, and he also has the ability or bilaterally, and he's also able to accommodate. I would also, at this time, check his optical nerve by using the Snellen chart. And what we would do is we would place the chart 20 feet away from him, and we would take a 3x5 index card. He would cover one eye, assess, cover the other eye, assess, and then cover both eyes and assess. And in the case that he was wearing glasses, we would do it with and without glasses, as well as using color charts to distinguish what colors he could and could not see. And then finally, what we would do if I had an ophthalmoscope, I would come in at a 20-degree angle and look for the red eye reflex, and if able to see that, would be normal. Okay, you still doing okay?
Mm-hmm.
All right, so next what we're going to do is we are going to look at some other cranial nerves, and those are cranial nerves 3, 4, and 6, which we did earlier with the cardinal gazes, which is ocular motor, which controls the movement, trochlear, and abducens, and those are all intact, as well as the optic nerve is intact with doing all those assessments that we did previous. You still good to go? Okay, so next what we're going to do is we're going to check out the ears, and I'm going to touch your ears real quick. Okay, the color of the ears are pink bilaterally. There's no scaliness, no discharge, no lesions, no foreign bodies, minimal cerumen, and I'm going to go ahead and look in your ears as well, okay? Okay. No foreign bodies. Great. I'm going to squeeze on the tips of your ears on your ears real quick. Is any of that tender? How about there? No. No tenderness in the auricle, the tragus, or the mastoid process. Okay. And if I had an otoscope, I would use to visualize the tympanic membrane. And at that time, what I would be looking for would be a pearly gray membrane and the bones within. At this time, we're going to assess the number 8 cranial nerve, which is vestibular cochlear. And then, Mr. O'Brien, what I need you to do for me is to use your hand and cover one of your ears when I get started. And I'm going to I'm going to say a 2-syllable word, and I just need you to repeat what you hear, okay? So go ahead and cover your ear, okay? Jacket.
Jacket.
Okay. The other ear. Baby. Baby. Oh.
Baby.
Okay. So, his vestibular cochlear nerve is intact. And then the last thing is that his vertebral fissure is midline and symmetrical with the tip of his ear. All right. And so, let's see. I'm just going to pull on your ears a little bit. His ears are flexible and they recoil instantly. Okay. So next what I'm going to do is I'm going to take a picture, take a look at your nose. Okay. The skin on your nose is pink, which is the same as the rest of your body. There's no lesions, no scaliness. Okay, it is midline with the rest of the face. Okay, and what we're going to do with for your nose is I'm going to actually test your olfactory nerve, which is number 1, and I'm going to have you smell 2 different things that I've labeled or that I've covered up the labeling on, and then I want you to just tell me if you can identify them. Okay. Okay, close your eyes. All right, tell me if you can smell that.
Vanilla.
Very good. Okay, and this one?
Peppermint.
Very good. Okay, and then the last thing I need you to do is if you could take your finger and plug your nostril, okay, and breathe in, okay, and then do the same thing for the other side. Okay, so his nares are painted. All right. Next, what we're going to do is we're going to take a look at the mouth, okay? And there's a few things that I'm going to need you to do with the mouth. The first thing I'm going to do is just go ahead and I'm going to move this hair on your face, okay? So he's got pink lips. They're smooth and moist, no cracking. Can you open your mouth for me? I'm just going to take a look. Okay. Can I see your teeth? Okay, open up.
Ah.
Say ah.
Ah.
Okay. And he has all of his teeth. They're white, intact. There's no appliances. His gingiva are pink and moist. They are, can I look just one more time? Let me see your teeth. They are not retracting. They are not bleeding. They're not swelling. His gums are, his soft palate and hard palate are intact. His hard palate is white and it has transverse rugae. His white palate or his soft palate is pink and moist, and it is not swollen, not bleeding. His tongue is moist pink and it's roughened on the top. It's a little bit white. It has papillae on the top, and the underneath of his tongue is moist pink and it has veins. He has saliva and it is present. Okay, and then what I'm going to do, Mr. Brian, is next is I'm going to take this tongue blade, okay, and I just want you to say ah for me one more time. Okay, and I'm going to open your mouth, say ah. Okay, his uvula is midline and it rises and falls with phonation. Okay, and no swelling or anything like that. And then what I'm going to do now is I'm going to, by testing the rise and fall of the uvula, his cranial nerves are intact. Cranial nerve number 12, hypoglossal, the vagus nerve, as well as the glossopharyngeal, which is cranial nerve number 9. And then they're intact because he can make phonation with his mouth, and he can speak, and his face is not drooping. And then the last thing that I'm going to have you do is I'm going to take a look at your neck, okay? The color of your neck is pink. There's no lesions, no lumps. Is that tender? Okay. No pain there? Okay. No lumps, no bumps, no tenderness. Color is symmetrical throughout. And then can you move your head from left to right? Okay, and then all the way around. He has full range of motion. And then do it one more time while I'm feeling it. Move your head around. Okay. No audible or palpable crepitus is felt in the neck. Can you push up on my hands? And don't let me push them down. Awesome. So his cranial nerve, his accessory cranial nerve is intact because I can't push down his neck or his shoulders. Okay, and then What I'm going to do, Mr. Bryant, is if it's okay with you, I'm just going to palpate some lymph nodes, okay? So the occipital lymph nodes are not palpable, okay? Preauricular, not palpable. Posterior auricular, not palpable. Tonsillar, not palpable. Supramandibular, not palpable. Submental, not palpable. Let me feel right here. Superficial cervical, not palpable. Posterior cervical, not palpable. Thank you. Can you, let's see, deep cervical, not palpable. Deep, not palpable. And then supraclavicular, not palpable. Okay. And then what I'm going to do now is I'm going to take, and I'm going to fill your carotid arteries, okay? I'm going to do it one at a time so I don't make you pass out. Just breathe regular. Okay. Thank you. All right. So the pulses in his carotid arteries are strong and equal bilaterally. And so what I'm going to do now is I'm going to take a listen to them, okay, with the bell of my stethoscope. I'm going to do one at a time, and when I do that, I'd like you to hold your breath, okay? Okay. Hold your breath. Okay. And there's no bruise noted in that. And if we did have some bruise, what that would indicate is some kind of occlusion or clog in an artery there, obstruction in an artery in one of the carotid arteries. But he does not have that. And then the last thing I'm going to look at is his thorax and his lungs. Okay. So if it's okay with you, I'm just going to look at your back and your chest real quick. Okay. So the skin on his back and chest are the same color as the rest of his body. There's no lesions. Is there any pain or tenderness in your back? Okay. How about up here? No lumps or bumps. Can you turn your head facing that way? Okay. Okay, I'm going to feel down your back, and if you'll just, every time I move my hands, if you'll just say a 2-syllable word for me.
Hello. 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 Hello.
Okay. Good. So the transverse diameter of his chest is 1 to 2. There's no, or tactile fremitus is present. His chest expansion is equal. The rising is equal and bilateral on both sides. And now I'm going to take a listen to your lungs, okay? So for that, what I'd like you to do is kind of face the camera for me. Okay. I'm going to listen to the front of you first. Just breathe normal. Breathe for me. Okay. Now I'm going to listen laterally, okay? Breathe normal. Take a deep breath for me. Okay. And if you can face backwards so I can listen to your other side. Okay. Breathe normal for me. Take a deep breath. Okay. Now I'm going to listen to you on your back, okay? Breathe deep for me. One more time. Again. One more. One more. Okay. All right. You can sit facing me. So his lung fields are vesicular and clear, anterior, posteriorly, and laterally, he has no signs of adventitious breathing. Okay, and then last, one of the last things I'm going to do is, if it's okay, I'm going to give you a little pinch here on your chest. Shouldn't hurt. Skin turgor is good. No tinting. One of the last things is, if my patient were a female, we would talk about breast exams, and I'm gonna explain if he were a female, what he would do at home for an exam. And what you would want to do is, for a breast examination, there's 3 positions you would want to have. One is with your hands above your head, with your hands on your hips, and then bent over. And while looking at that, you would want to make sure that the symmetry of the breasts are the same, the size are the same. There's no swelling, pitting, edema, lumps, bumps, orange peel like skin. And you would also want to pay attention to the colors of the the nipples should be the same color and darker than the breasts. No swelling. You should also be able to take your nipples and no discharge be present. There's 3 different methods of palpating the breast. One is like the spoke of a wheel. The second one is circular, and then the third one is in straight lines, vertical lines. And while doing that palpation, you would want to make sure that you pay attention to your axillary lymph nodes, your anterior, posterior, lateral, and central axillary lymph nodes. And if you have any changes, lumps, or those are palpable, you would want to contact your doctor. And then the last thing, Mr. Bryan, is, can you tell me those 4 words again?
Dog, house, orange, star.
Okay, and so he was able to remember those 4 words, so his recent and remote memory is intact. Okay, thank you so much.